Hi, today we're going to talk about the relationship between the heart and kidneys. The most thing effect on kidney and related to the heart is hypertension, which is increase in blood pressure for many reasons. One of them is kidney enzymes. I won't keep you longer, so I'm going to explain the mechanism directly. The hypertension does atherosclerotic changes of renal arteries, which means narrowing of the arterial lumen. So the blood supply will be decreased, and then will happen glomerulosclerosis or tubular atrophy or interstitial fibrosis. Any one of them can lead to a renal failure. When glomerular filtration rate decreases, happens activation of renin and angiotensin and aldosterone system. These are enzymes produced by kidneys to improve the glomerular filtration rate. By another way, hypertension makes blood passes fast on glomeruli, so reducing the glomerular filtration rate and increased salt retention, which also increases the blood pressure again. Do you know that 10 years or more of hypertension with the presence of left ventricular hypertrophy can get you the end stage of renal failure? There is a pathophysiology disorder of heart and kidneys called Cardiorenal syndrome, which is acute or chronic dysfunction in one organ inducing acute or chronic dysfunction of the other organ. And there are types of it. Type 1 is acute cardiorenal syndrome, which is acute cardiac dysfunction leading to acute kidney injury or dysfunction. Type 2 is chronic cardiorenal syndrome, which is chronic cardiac dysfunction leading to permanent progressive chronic renal failure. Type 3 is acute renocardiac syndrome, which is the exact opposite of type 1, meaning kidneys that induces acute cardiac dysfunction. Type 4 is chronic renocardiac syndrome, which is the exact opposite of type 2. Finally, type 5 is secondary cardiorenal syndrome, which means systemic diseases such as diabetes, mellitus, and sepsis that causes cardiac and renal dysfunction. Finally, thank you for listening. I hope you learned something. Thanks again, and subscribe for more.